Hello everyone. In this session, I'm going to discuss international death certificate, and basically I will be describing all the lines, the 5 lines on the death certificate. So let's start it. So let's start with international death certificate. It's a very important topic from exam point of view. So international death certificate, the basis of the mortality data is the death certificate. So we give mortality data on national, international basis based on the death certificate. But for ensuring national and international comparability, there it is necessary to have a uniform and standard system. That's why WHO has recommended international death certificate. If you see the death certificate, it is same in every country, whether the country is India, whether it is Japan, whether it is US, any country, the death certificate, its lines are same for international comparability, and it is designed and given by WHO. That's why it is known as international death certificate. In the international death certificate, how many lines are there? So basically there are 5 lines. The 4 lines are compulsory to be filled. The 5th one is optional. Okay, so line 1A, 1B, 1C or 1D. If you can fill both of them, it's good. Otherwise, one of them, 1C, has to be filled. And line 2 is there. So these are the various lines. Now let me tell you the meaning, what you have to be filled in these lines. So in international death certificate, it looks like that. You have to fill the details of the deceased, the name, the age, and all thing. And you have to fill the death certificate lines. In the death certificate lines, the first line, the line A, indicates the disease or the condition directly related to the health. The line 1B indicates the antecedent or underlying cause. So this disease is leading to some cause, some antecedent cause that is causing the death. And 1C or 1D is the main cause. Currently, right now, the death is due to this one. But this one is due to this and this one is due to this. So main disease is line 1. And line 2 is indicating some other diseases not related to the death but present in that particular diseased person. So let's take an example. You can see here. Have a look. So this is the line 1. This is line 2. On line 1, the main diseases which are directly related to the death have to be filled. 1A, 1B, 1C, 1D. In 1A, you have to write the main disease. In 1B, you have to write the underlying cause or antecedent cause. In 1C, the underlying or antecedent. In 1D, the finally underlying or antecedent cause. In line 2, you have to write the other diseases which are not contributing to death but present in that person. So that is the cause. That is the death certificate lines you have to fill. Let's take an example. Let's take an example. There is a person who is having diabetes mellitus. There is a person who is having diabetes mellitus. Okay, the diabetes mellitus, you know, if it is treated properly, it's good. But if it is not controlled, the sugar is not controlled, it leads to 3 organ failure. What is diabetes mellitus? In diabetes mellitus, the blood sugar, glucose level in the blood is high. That is, the person is having hyperglycemia. There are 2 types of diabetes, type 1, type 2. In both of them, the common feature is the hyperglycemia, high glucose level in the blood. If it is treated, it's good. If it is not managed in long term, after 5, 10, 15, 20 years, it damages 3 organs in human body. The high sugar, it damages the retina, causing diabetic retinopathy. It damages the nerves, peripheral nerves, causing diabetic neuropathy, and it damages the kidney, causing diabetic nephropathy. So currently I am saying there is a person who is having diabetes mellitus and the sugars were not well controlled. So the person developed diabetic nephropathy, and because of the diabetic nephropathy, the kidneys are failed. Because of the kidneys failed, the person went in acute renal failure, and that is the current cause of death. So current cause of death is renal failure. But why the person have renal failure? What is the underlying cause of renal failure? It's diabetic nephropathy. But why the person have diabetic nephropathy? What is the cause of that? So main cause is diabetes mellitus. So this is the main underlying antecedent cause, that is diabetes mellitus. You got my point? So here the cause of the death, current cause of the death is renal failure, but renal failure is not de novo. It is due to diabetic nephropathy. And why the diabetic nephropathy? It is due to diabetes mellitus. So main cause of death is diabetes mellitus. Coming on second example, there is a person who is dead because of the intraperitoneal hemorrhage. Suddenly the person started bleeding. There is an intraperitoneal hemorrhage and bleeding, and the person is dead. But why the person may have intraperitoneal hemorrhage? There is rupture of a metastatic deposit in the liver, inside the abdomen, inside the liver. There is a metastatic deposit which get ruptured, which was vascular and get ruptured. That leads to intraperitoneal hemorrhage or bleeding. That is the cause of the death. Okay, but why the person is having metastatic deposit which is ruptured? On the liver, there is a metastatic deposit. Because the person is having adenocarcinoma of the colon, which is metastatic to liver. In the liver, multiple metastatic deposits are there. One of them is ruptured, leading to the bleeding, and that is the cause of the death. In both of these persons, apart from this, the other disease is the hypertension. Hypertension is not related to death currently, but it is also present in that patient. So currently, tell me, out of these all 5 lines, which is the most important line? The most important line is 1C here, that is telling the final cause of death, the ultimate cause of death, and here line 1D is there. Here 1D is optional, it is not filled now. So line 1C or 1D is known as most important, and it is known as essence of death certificate. You got my point? So there are 1A, 1B, 1C, 1D and 2. These are the 5 lines present on death certificate. On 1A, you have to write down the acute cause of the death, the current cause of the death, okay, the main cause of the death. But it is due to what? What is the antecedent reason leading to this? And the main antecedent underlying cause, or ultra main, the final main antecedent or underlying cause. In line 2, you have to write the other associated diseases which are not directly related to death right now. So this is the thing. The essence of the death certificate is line 1C or 1D. I hope examples work better. So in your exam also, you have to explain with the help of the examples also. So I am repeating one of the examples. There is a person who is dead because of the acute renal failure. But why the person have renal failure? Because the person have diabetic nephropathy. The kidneys are already failed. Why the person have diabetic nephropathy? Because the person have diabetes mellitus since years. So main essence is the diabetes mellitus. Okay. In the same way, we have seen another example. There is another person who is dead because of bleeding, intra-abdominal bleeding, intraperitoneal bleeding. So why the person have intra-abdominal bleeding? Because of rupture of one of the metastatic deposit present in liver. Why the person have metastatic deposit? The person have metastatic deposit having some primary tumor in the colon. So the person have colonic adenocarcinoma. Now see the reverse. The colonic adenocarcinoma leading to metastatic deposit in the liver. The metastatic deposit in the liver get ruptured, and that is causing the intraperitoneal bleeding, causing the death. Here also the diabetes is leading to diabetic nephropathy. The diabetic nephropathy is leading to acute renal failure, and that is causing the death. So main essence is line 1C or 1D, that is giving you the main overview that what is the cause of the death. Okay, so that is the essence of the death certificate. Let's solve some MCQs on that. The question is in front of you. In WHO recommended death certificate, main underlying cause of death is recorded on 1A, 1B, 1C or 2. Main underlying cause. I am asking for the essence, the main underlying cause. So yes, you all are right, it's 1C. 1C or 1D both will work. That is the essence of death certificate. So in university exam, you usually get a 3-mark question or 5-mark question on lines of international death certificate. So you have to write it. You have to write the total 5 lines, and you have to write which line is indicating what. You have to give 2-3 examples to explain. I have given you the example now, so you have to explain with the help of examples also. That's all about it. Thank you.
Hello everyone. I hope you found this concept clear and easy to understand. If you would like to dive deeper into this topic and master it with full-length lectures, you can subscribe my app, that is MedLife by Dr. Priyanka. So join me for the live sessions where we break down the complex topics in a way that makes them simple and high yield for exams. See you inside.